Okay, well, welcome to the session today, Dynamic Tools to Foster Interprofessional Practice with Children, Early Intervention, Pre-K, K-12, or school settings. And this is an invited presentation. It's sponsored by a group in ASHA that is called the Interprofessional Education and Practice Topic Committee. So ASHA often starts focusing on creating topic committees and groups around key issues, key current issues. And they invited this presentation today to focus on practical aspects and how to apply interprofessional practice and collaboration within those settings. The reason we grouped EI, Pre-K, K-12 is because there are similar practitioners or similar providers in those settings. Many of the community and healthcare related practice settings also involve more medical personnel than do the organizations that don't focus as much on medical. Okay? Oh, talk? Okay. Are we talking enough? Do you want me to talk more? Oh, okay. Right there? Okay. And talk a little louder too? Okay. All right. I'll try and keep on target here. Oh, am I blasting everybody out? Okay. Oh. This is confusing. Okay. A little about me, Jean Blosser, and I have focused my entire career on school-based service delivery. So I haven't focused on particular disability categories or serving any particular population, although when you work in schools and early intervention, you tend to work mostly with language and phonology, complex disabilities, multiple disabilities. So I've run the gamut. I've been working for decades, so I've run the gamut of places to work. So everything from public schools to private clinics to universities, private organizations such as staffing organizations, and today I'm doing mostly consulting. I consult with lots of different entities, school districts, organizations that work with school districts, healthcare organizations, education direct departments, and things like that. I do a lot of training, but I also do program development and have come to focus on anything related to school outcomes, achieving good outcomes, like really achieving outcomes, really knowing that you achieved outcomes, which we'll talk about today, as well as different kinds of program designs to accommodate the multiple entities that are working with children. I've authored some materials, in particular a book, which I have a copy of today if anybody would like to see it, School Programs in Speech-Language Pathology, Organization and Service Delivery, which covers the gamut of school service delivery models, etc. ASHA requires disclosures. As a presenter of CEs, I am sponsored by ASHA, schools, organizations. I do get fees for that. I'm a consultant with Creative Strategies for Special Education, which is my own organization. And then I am an author of educational resources for which I receive royalties. So, what do you want to learn today? What did you, when you selected this session, what were some of your driving topics that you would like to make sure, boy, I hope we discussed this. I need to kind of, get some kind of a different feel for other aspects. So what were you thinking? What's one aspect?
So one of the questions in my mind is when folks are practicing interprofessionally, but they're really just in the same room. So there's a range of frontline providers are at interprofessional developments, and I'm sort of looking for a process to help move those who really aren't there yet.
Okay. To briefly repeat the question, or the interest that you have, it's that while people are practicing together, they may not be practicing interprofessional practice of service and collaboration, and what maybe be some processes in your case to foster that. And that is exactly what this presentation is about. So we will address that. And I have a couple of analogies that I like to draw about the differences between interprofessional, the concept of interprofessional, and some of the other typical titles that we hear about: transdisciplinary, multidisciplinary, etc. Any particular aspect that you have an interest in? Right. So we will be looking at several processes, and I think that they're processes that are pretty practical. And then the issue becomes, well, then how do you get your other team on board? And so got some tools on that. Getting everybody else on board. And why aren't they on board anyhow, So did you have okay, getting people on board.
You want to share it with everyone, and people are just like, more work to do.
Well, more work to do, more training sessions.
I'm trying to help. They look at it as, you can do what you want to do, but I'm not adding anything more to my plate.
And that's what a lot of people feel. And I don't blame them in a way, so we want to just talk about, well, how can we change that dynamic?
You want them to realize, we're all going to the same goal here.
Exactly. Well, and that really in and of itself, getting people on that same page for the same goal. So I've really developed something that I think that could be very useful for that particular thing. So the 4 outcomes that I think we've covered in your questions, I'll go over. One is to discuss the positive outcomes of interprofessional education and practice. So there really are some benefits to it if it's done in a way where there's an actual sharing and an actual exchange and an actual co-participation. There are definitely some positive outcomes. So a starting point will be to appraise your teams where you are now, to really take a look. And so there's a team appraisal process, and with that process there's 6 key areas, and how to get those areas going, and then how to also get people's feedback on your team about what they're thinking about collaboration and the process. There is I've developed also a 6-stage collaboration process, and I think the realization that not everybody's on the same page, so why not start with the page that they're on and take them from there. So to hopefully to kind of open some different ways of thinking about where we are with the collaboration process in each of the different settings, or even each different teacher partnership or collaborative partnership. And then really the focus of the session is all around tools, just as the title said. So I always try and be practical in my training, because I want to make sure that everybody leaves with things that they can take back and share with others. So we'll be sharing those. Now, I did upload the PowerPoint as well as the tools. And so you should be able to download them and use them. And then also, if you've noticed on the first slide, you have my name and my email, my phone number. And if you can't download it, I'm happy to send it to you. So For me, it's all about sharing, and this is a pointer versus a, oh, there we go, okay. So we did that, I went backwards, okay. So quick agenda, you know, I want this to be a workshop for you. So it's kind of nice having a small group because then we can actually talk. But we can actually talk in a big group too. But I think the thing is, we want to look at the benefits and the outcomes of partnering with others. And I really do look at it from a perspective of partnering and collaborating. So I think we can't let the word interprofessional kind of take us over to the point where we feel like we're so out there that we can't do it. You know, this is really partnership stuff. And when you're in partnership and on the same page with people, then things happen, great things happen. So we'll talk about that. We'll talk about the actual how to form partnerships. And then the appraising, the collaboration, as we mentioned, seeing where you are now, the structured process format, and then all through the whole session, just feel like you can ask questions anytime. And feel like you can divert the conversation a little because it becomes more relevant to everybody when that happens, actually. Also share your ideas. Disagree. Please disagree. If you think that it doesn't really fit your need, or you've tried it and it didn't work, or no time and those kinds of things, let's talk about that. So the focus is on your program today and your perspective and how to apply whatever we're talking about to your perspective. Questions, comments, recommendations, all welcome all throughout. And hopefully at the end, you will have developed an IPE action plan for you, for your site and your team. We talked about your objectives already, so thanks for sharing those. And I do think we're going to hit those objectives. Whenever I do a workshop, what I like to do is I like people to start honing in and focusing on their programs and their needs. So if you replicate any of this, it's always really good to get your teammates to really start talking from their perspective, because it's the only way you know where the mismatches are. So we're going to start by talking about what is interprofessional education and practice, or to abbreviate, IBPE and IPP. I actually use IPC myself, which is interprofessional practice and collaboration, or just interprofessional collaboration. So I have a lot of derivations on the subject. So, ASHA really, as I said, they're focusing as an organization on the importance of interprofessional. And this came from, it really has bubbled up from the World Health Organization, where that they began to define the terms. And that's why we're seeing Canada do it. We're seeing other places that have different sorts of healthcare and education systems looking at it, calling it different maybe, but the issue is common, shared, coordinated care. So the strategic objectives that ASHA has defined, they really want to take some efforts to really change the way we, in school practice, early intervention practice, healthcare practice, the way we practice, the way we do our job. And we've been doing this job for decades, and things haven't really changed a whole lot from the time, I entered my first job until now. Some of the service models are really the same. And, it's overwhelming to me that for now 20 to 30 years, probably 20-some, people have talked about collaboration in our profession. And we still are doing pull out. So it's like, what? So we have to, again, look differently. How are we paid for our services? So you have a big dilemma where you work, where you're using this common electronic healthcare record. And when people are together, either together physically or sharing bits and pieces of treatment, how do you bill for that? you don't have to bill, you're lucky. It's a miracle. You just have to do your job. But, that is a dilemma. And so, of course, ASHA being concerned about the reimbursement and so forth, it's really trying to look at.
You guys don't get paid.
You don't get paid if you don't.
So I contract with our county
Mm-hmm.
to do preschool.
Uh-huh.
And if I don't see them individually as on their IEP, I don't get paid.
Right.
So I would like to collaborate with the teacher, or that's
And everybody then has to feel that same way, that it's on their dime. So this is one of the big barriers. We'll talk about barriers in a minute, because the barriers are prohibiting us from actually doing. Doesn't stop you, but you're the one person.
But you feel like
Yeah.
it just makes you feel less professional and devalued.
Mm-hmm.
That, we don't even get 15 minutes to say, talk to the parent, talk to the,
Right. Right. And those are the dynamics that need changed.
Yeah.
And change is hard, but they are the dynamics that need change. So we also, I'm not going to go through every one of the aspects on this slide, because I'd rather get to the heart of it, but the way others perceive and value our service. If they don't know about us, they can't value our service. So, science underlying service delivery. And really, it's, only really just beginning to try and look at which service delivery models for treating which kinds of disorders, for how those models are organized and developed, what the membership looks like, what we're comprised of now, and then our partners, and how are they addressing these related disorders and needs around the world. So I love having somebody from Canada here to hear your perspective and your situation as well. So really underlying interprofessional education and practice is there's some common core sets of values. And one of them, well, I'll go through them all, but learning together is really a driver for making it successful. So just think about that, because you have to be together in order to learn together. And so physically where you are, as well as where the daily activity takes place, then people can begin to coalesce their experience, because they actually are talking and working together. And you can solve clinical issues that way. You really can address, you can define the clinical issue and clinical problem, and then you can solve it when you've got professionals together, you've got some expertise and brain power together, and then you can provide a more comprehensive treatment. So this is how the interprofessional focus has really why it's evolving, so that people can do these things that we know work and improve our services. So I just say everybody's talking about it right now. It's really I think it's good, because we've been talking about collaboration for 20 to 30 years, but now this is giving it a kind of more of a framework to work within that's different than some of the other collaboration frameworks. So universities are talking about healthcare. There's a MGH, Massachusetts General Hospital and University. They are very advanced in their clinic and service delivery. They've got a lot of great programs. They've got a lot of collaborative teaching. The students are not just sitting in class with each other, but they're sharing. So if you're looking for a model, that's a really good model, is that one. So educational settings, well, clear back when we first started having IEPs, and we started having the people that came together to develop IEPs, it was all about having different people in that room solving problems. It just hasn't quite worked the way the intention is, and the intention is truly that way. So even our education laws are starting to change a bit to address how we can get people together. Now it's got to trickle down and through our systems, and people have to get past the time problem. Our professional organizations, not just ASHA, but OTPT, and different groups that we work with are all talking about it. Again, they may be still talking, they're talking at two levels, in some ways in silos and practice settings, and then at the organizational level, sort of like this, in sessions and committees. But that's how key ideas get fostered. So one of the ASHA offices works on what's called an interprofessional professionalism collaborative. So that's how they must have just named themselves one day. It's like, what do we call ourselves that really, captures it all? So Loretta Nunez, it's a good name at ASHA. She's very active. There's 11 health professions represented in this group. And they really are trying to solve this. So they're coming up with a common set of values, a common ethical ethics. They are developing toolkits and educational resources, and they're trying to foster the evaluation and development of interprofessional professionalism and those behaviors that define it in different settings. So in the PowerPoint again, or just remember that name, interprofessionalprofessionalism.org. So that's a place to get some great resources. So I wanted to just give you, some definitions that people are using. So, this one comes from that IPPC group, and it's about demonstrating core values of caring and excellence and so forth. So, I don't want to spend too much time, so I'm going to speed through some of these slides, but they are there just for your benefit. ASH is trying to educate stakeholders, foster connections between organizations, promote research about it, and then incorporate those competencies into all of our certification and accreditation. So the vision would be in the future, all professionals would have the same common base and foundation, not just that you all learn statistics together separately, but that you learn to really, from each other, work together. ASHA has a ton of resources on IPE and IPP, and these are practical resources. They're materials, activities, and those kinds of things. So again, if your organizations are trying to focus on this purposefully, there's enough out there. I like the principles. So it's not a replacement for education or practice, and it's one solution. It's not all solutions. So this isn't going to take over the world, solve the world. This is like another philosophical viewpoint that makes sense. And so experiential and team-based learning are the hallmarks. And I mentioned Massachusetts General Hospital. So I watched a video that they had and shared, and they have actually that they were having all the parents of this one clinic bring their kids, and then all the professionals were in there, and they were all working so simultaneously with each other that it was remarkable. And it wasn't just like your turn, my turn. It was definitely working together. So I don't want to belabor these, but these are terms that people have used for working together. Multidisciplinary teams, transdisciplinary teams, cross-training, interdisciplinary, care coordination. These are all terms that imply people working together. There's some missing elements to this. And I gave the example about when taking statistics. When you take statistics, it's like, yeah, it's one of those courses that all the professionals take at the same time, but then they apply to their own, their own discipline, basically. See if my favorite example of an IEP, I call them sandwich IEPs. So in a sandwich IEP, everybody sits around a great big circle, and people walk in and they generally sit down next to their friend. The parent will come and they'll sit wherever there's a leftover chair. all the people are sort of sitting around that table, very comfortable with their pads and their paper, and the parent walks in, they've got their coat on still. Nobody says, may I take your coat and put it, and may I get you something to drink? Because we're all drinking coffee because we just came from our office, and we grabbed that cup on the way. And so then now we're all sitting together, and we start. So the psychologist gives his report, the social worker gives her report, the speech language pathologist gives his report, the OT gives her report, the PT gives her report. And the parents like watching this sandwich build. And everybody's got goals. So I've got my 3 goals, you've got your 3 goals. The teacher says they have to learn to read, they have to behave, they have to do, the math, they have to get ready for a job, they've got to get ready to enter kindergarten. So they've got all these big goals, but everybody owns their own goals. So while I'm telling you my goals, you're kind of just like thinking about your next day. You're not thinking about my goals. I have to get you to think about my goals. Then we can start really having interprofessional practice. But if you're just going to think about your goals, and this poor parent's trying to go, huh? What? Now my granddaughter has high-level Asperger's. Depends on if you're talking to her. I've got to put this on record, but her grandmother or other people. But at any rate, so she's got the characteristics. A 17-page IEP in 2nd grade, and I got bored reading it. And I'm like, I wanted to read it just to learn from it, to see what they were doing. I was bored, silly, and I was highlighting and trying to understand it. My daughter-in-law is like, she's getting smarter and smarter every day about IEPs, where I won't even talk to her about it because she knows more than I do. And I mean, it's just crazy.
I would add my other comment to that. In that process, what's missing is the family vision.
Totally. It should start there.
It should start there, and the professionals need to work their goals together.
Around that vision. They need to help the family achieve the vision. And I would go as far as to be able to say that's where I think the education vision comes to play, because education is the core reason the kids are in school, right? So we need to keep that vision in mind, those two together and how they work together. I do think EI addresses that better than.
I was just going to say that I'm in CPSC, so we're pre-K, grade 5, and at the meetings, it's not most of the meetings that I go to. It's the CPSC chair, myself, the parent.
And did you just stop talking?
They might bring in a general ed teacher.
Right, which is needed for the transition to happen. Right.
But, if they're getting TOT, then yes, they're there too. But there's no, maybe as minimal as possible, and
right.
There's no discussion. There's no, where do you want to see your child? What are your goals for your child?
Yes, somebody has to take charge of that. So they don't want the time. I know that word, that time word. How about you? We welcome to our group. What type of setting are you in? Oh, great. Okay.
We had a 17-page IEP. We would have
Yeah, it is crazy. The scary thing about it is our medical reports, so there's kind of a couple things happening. Our medical reports used to be like you'd go into the doctor's office and they'd have a 1-inch folder on you, right, with all this. And you're kind of go, do you remember like 2 years ago when I had blood pressure problems? And, because that's buried down there. Now the big controversy, which I think is going to get into the schools pretty soon, is the electronic medical record where everybody's now just using cryptic notes. And codes and things like that. So now what? Because somebody has to look at all that and try and put it together. And that is the intent of this group. And so championing is something that, in order to start it happening, we got to have the champion. And it probably is you at this point, to try and draw from the parent that question, which is so important. What do you want to see? And I remember when I used to ask that of parents all the time, it would always be my first question. And it's like, okay, well, what would you like to see happen? And they had it just down pat. I just want him to be able to talk to his brother. I want him to be able to say his brother's name. I want him to talk to his grandma when she calls. And that was a good vision, because if you could get him talking a little bit and anybody could understand it, we had success. And once you start down that success trail like that, and you keep bringing out what's going to make it work for your family when this kid, and especially with the multiple problems now, the behavior is really where managing behavior is huge. Well, managed behavior is controlled by language. Understanding, not understanding, falling apart because of not being able to communicate feelings, emotions.
Actually, really, having, I have complex political administrative background. But I definitely have worked in schools where culture is collaborative, but it has to have the buy-in of administration. You have to have a culture of playing together. And you have to be, it's okay. You can collect data on my goal. I'll collect data on your goal. It's okay.
Mm-hmm. Right.
It's one little thing. What's the critical thing? But I don't think without that culture and that clear permission.
Absolutely. Yeah.
To do so, it's very hard to get a place. I have programs that
Yeah. Yeah, so, I have I think I've got a slide in here about culture, but I have a whole workshop I do on culture in schools, because you do have to have a culture of interprofessional collaboration, not just being acceptable, but being, like, this is how we do it and why, and it is a leadership issue, buy-in issue. I have a slide, I think, that will come up on that. Well, okay, here it is in a nutshell. When you see a star, too, this is something that I think it's a real takeaway and kind of action item. So here's what, to me, the best explanation of interprofessional collaboration. And that is when people learn about, from, and with others. So this is kind of this missing element here. It's like you can't just read the 2 pages in your book in college and go, now I get what social work's all about. You really have to understand what social work's all about. And everything that they know that impacts on the family's success or the child's ability to show up for school in order to be able to get into the services and utilize the resources that are out there. You really have to understand what's happening in these kinds of, in the dynamics. So I think it's the about, from, and with that I really honed in on, and actually in preparation for this session, because that's the dynamic that is different. It's like coming up with a process, coming up with a formula and a format for helping people learn about communication disorders and learn about speech, what speech language pathologists can do and contribute. But don't stop there. Learn about what's going on in that family, the classroom, the health, the medical. Learn really about it and what that impact is. So you had a question a minute ago. Do you remember what it was? You can. Please. Okay. Will it come up again? Okay, sorry. Okay, so tell me, anybody have an experience like where they would say, this was the best, it worked? Okay.
Okay, so I supervised SLPs in a large district for 20 minutes.
Mm-hmm.
And one day they came in and said, you aren't going to supervise SLPs anymore. We're going to give you a group of educators.
To supervise?
To
Oh,
supervise.
okay.
Okay, so these were ESC educators. And they did that for a couple of years, and then they said, okay, now you're going to supervise school psychologists and social workers. Well, there was a lot of resistance. I'm an SLP, and I kept saying, but I'm an SLP.
Right.
You know, this is what I do, this is who I am. And of course, we collaborate. I thought it was great.
Absolutely, we're wonderful at it.
Well, wrong. I really
Yeah, we talked about that earlier. No, I heard.
But what I discovered about myself, and I was really embarrassed when I figured it out, was that I had not walked in the shoes of the
Totally true.
I did not really, in my heart, appreciate what a great teacher was. I held school psychologists, that's way more information. And I really did not have, and I came from a mental health background, but I did not have the grasp of when kids are homeless, what that means.
Yes.
And the impact that has, everything research,
Right.
blah, blah, blah. So, and I don't know how to translate that to other colleagues, because SLPs work harder and better and are smarter than any other profession out there as far as I'm concerned, but we're way too isolated.
I totally agree, and I think it is the model that we've all grown up on and we're trying to break. We are very isolated, but our organizations have us in silos because that's where we put all of ourselves. And then that time thing, which we'll keep coming back to, because that's efficiency. So this is kind of my mantra, truly, is collaboration is essential. And to me, that means you cannot get this job done unless you have other people to do it. Because using the traditional service delivery models that we use, twice a week, half an hour, Monday, Wednesday, if everybody shows up, that's not working. Even bring them into your site, however many times do they come to your site? 5 days a week, or what? Oh, you don't bring them into the site at all. You're traveling wherever they are, whether it's a setting and then you are in the home. How often are you in the home? 2 to 4 times a week. And so our models, though, really limit it to no matter what we do, it's hours. Okay. Hours. Yeah.
Say that too.
Yeah.
Kids. And I try to distinguish.
Our kids.
They aren't our kids.
Yeah. They're everybody's kids. Exactly. So this kind of catches it for me, that partnering with I say education partners, slip it in, administrative partners, medical partners, whatever. Partnering with our partners is a great way to have fun at work. Because my gosh, when people are interacting together, you start hearing their trials and tribulations. You start having this a different appreciation, but you also start building a relationship. And so then it really expands your horizon. You really do learn not only what their job is like, but what that perspective is with regard to the kid and their success and development. So that is the only way we're going to achieve the highest potential for kids. With kids, they'll achieve the highest potential.
Okay, and I won't talk too much, but there's also another reason to do it. I had this aha moment sitting in a case with a bunch of attorneys in the school district, and the psychologists get done me down, the social worker, and the SLP, and the educators had their data. And I walked in just to observe, and I always read the psychologist's report, the social worker's report, because that's what I'm observing. And since the SLP's there, I've been like, well, what the heck?
Right.
Well, what I found out was that in the area of communication, in their different assessment tools, they had different results, and they didn't even know it. So the attorneys are walking into the room, and I'm looking at the Feynman score, and I'm looking at the WISC score, and I'm looking at the SALT score, and I'm like, oh, you guys better get it together here, or you're going to be in serious
Exactly.
And, you know, we don't even read each other's.
Well, that's exactly right. We talked about this IEP thing. Well, no, we didn't dwell on it, but you made a good point about it. It's like you can't drone out. You can't zone out. You have to understand. But when it's so complexly written, and then you go, you know, like, okay, one of my favorite examples is in a psychology report. They almost always say the kid is auditorily distractible or visually distractible. And then that's fine. But we never really, my ha-ha moment is, oh, really? Because then that means, or they'll say that kid's slow auditory processing. Well, for me, the translation is this. If I have a fast-talking teacher, that kid's not going to be able to learn from that teacher because she's talking too fast. So we got to bring those points together. Or if I have a kid who's visually distractible and they have me for a teacher, what are they watching? My hands. It's not about the color on the wall or the picture on the wall. It's about the person who's teaching them. And if there's something going on with a lot of movement, or if there's something going on with dress or moving earrings or noises and people dropping things, that is what visual and auditory distraction happens. It's what it looks like. So if you don't make those connections for them, they're not going to make the connections. Well, I'll give more examples like that when we get along here. So I look at collaboration and outcomes in a very unique way. So we're used to looking at outcomes being about kids' outcomes, right? How much did he functionally change from when you started treatment to, 6 months later, a year later, end of year report, whatever your marking points are, monthly, whatever it is, we're looking for change in the child. Well, I think there's other dynamics that come into play. I think we have to look at partnership outcomes. So if you and your partner are not communicating to the benefit of the child, what could you do to improve that outcome? Because ultimately, that's going to carry over to the kid. And then, what programs do we have to put in place to make it happen? And that's a cultural thing. So this is how it all comes together. And there is, by the way, for those that just walked in, the PowerPoint is on, it's been uploaded, and the handouts are uploaded, all the handouts for you to use, okay? So just briefly, just to remind ourselves, improved functional outcomes is what we're looking at. I've added in low and high demand situations because actually classroom are pretty high demand situations. A lot going on, lots to communicate about, lots of demand for communication. You can't have improved education performance with a kid who has a communication disability without improving the communication performance. You have to have these two go together. So education performance really requires improved communication in kids that have those issues. Then we have collaborative partner outcomes. So what would it look like if our partners were, if our partnerships were actually working really well? Well, we'd have improved relationships. The most important thing is we have increased understanding by the parents and families of the impairment. Just like the example you just gave. It's like if I don't understand what that whisk means and I'm blanking it out, and I even have a different one and I don't go, why do you think we got different scores? That's what you wanted to happen. Not in court, but in a one-on-one meeting together. That's when you wanted to go, what do you think happened? And maybe it would be he was tired that day. Maybe he was distracted. Maybe he was hungry. Maybe there was a lot of noise going on. Maybe what? Let's hear what. So when we have increased understanding by our education partners, we can really begin to understand what the dynamics are. Then we can have increased dynamics or increased team coordination and competency. Now we can figure out what to do. That's the accommodations part of it. So without these pieces like coming together, so how do you get that to happen? You need some systems situations happening. So you're an administrator. So how do you get, the only way to get greater efficiency and effectiveness about our programs is to really start with these kinds of dimensions. It's like, how do we get our people working together? And that'll sort of get to better performance of kids. And we can then maybe put in some new programs. Or we can decrease caseloads. We can change the dynamic of what we do. So I see that in order to be successful, we really have to kind of look beyond just trying to finally gather some information about performance of speech only. So thinking about beyond that. So service delivery outcomes, again, just to be reiterating, and we got to join forces to learn about each other's capabilities, roles, responsibilities, and contributions. Okay, so easily said. Now how to done. So I have a 6-stage formula. Again, this is a PowerPoint you'll receive, and I put it in 6 stages because I think it's an action kind of process. So first you have to have a foundation. If I really don't understand what you do or what your healthcare professionals that you're not even bumping into sometimes are doing, what their role is, I run the risk of not being able to get the maximum services to the kid. So my place to start is always by really exchanging information about what I do, how I contribute, and so forth. Okay, this is my disclaimer for the rest of the session. You cannot do this with your whole caseload. Pick whatever, a group, pick a family, pick a school. So in order to kind of take on a new philosophical approach, you want to just do it slowly. And honestly, if you get it done over the lifetime of your career, that's great. But when people get overwhelmed by trying to do it and get frustrated because not all the teachers show up, that's when we start stopping it. Start to stop. So anyhow, we want to just establish a foundation. We want to talk with somebody about our roles and their roles and responsibilities, and we want it to be somebody that wants to talk to us. So that's the other kind of caveat, is you can't bang your head against walls and feel successful. So start getting your processes in place with those teams that you really work well with, or the kids that you've identified that they can really make success if you can get things going on a different train. So it's really not about trying to change a whole school, because that takes too long, or a whole organization. You want to build your team's understanding of impact of disability. So I really feel like one place that we've kind of been in our little expertise cocoons for a while. Like, we know what such and so disabilities characteristics are and what it is. We have to start letting other people know what we know. So it's, what do we want them to know about us, from us? So I think they need to know about the impact of a disability on learning, on being a family member, on play. They have to understand from our point of view, we have to help them understand impact. And when you hear in schools adverse effect, that's what they're talking about. It's like, does the disability have an adverse effect on learning? Simply said, is it going to prohibit him from really understanding the vocabulary as it gets more and more difficult, more and more subject-related, more and more difficult, and multiplying the numbers that you have to get, and the different classes that you have to get? What is the impact of a kid who has a very low vocabulary, is very behind, enters school in competition essentially with kids that have 50,000 words, and he's entering with, 200, 300, 1,000 maybe? That's a big gap, but why? That's the thing. Help people understand why that's a gap. So that impact of noise, the impact of visual distraction, the impact of poor memory, the impact of behavior on learning and participating with other kids. The next level stage is jointly identifying those learning demands. So we can say, this child has, phonological processing disorder, and we can say that means blah, 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 blah. We have to say, well, then that's going to impact reading in this way. And then you got to know, does it? You have to see it in action. Does it really impact? Because then you can suggest they work on the accommodations and get other people doing some of the intervention techniques that we know work. When you do that, you can multiply your service delivery beyond you. So this process is all designed to be where the person is, to be where your partner is. So if you have multiple partners in a school building, how many teachers are in your school building? Let's pick one school building. 50. Okay. How many in yours when you go into those schools? Just pick one of your days. 30 is about, I think it's 30, literally 30 to 40 is probably average in many of our schools. The bigger city schools are many, 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 many more. Okay. How about anybody else? What type of setting are you in?
I'm in a specialized.
Oh, okay. Okay.
There's 12 teachers in that school.
Perfect. Mm-hmm.
It's a very collaborative school because they all share students.
Yes.
So, as a speech and language person, I'm in each classroom. So, it's kind of like, we all talk about inclusion.
Uh-huh.
Our kids need to be in general ed. And so now that's where I've always worked.
Uh-huh. Great.
So now in this it's interesting to see the reverse and to see that, yes, I'm an inclusion person, but I see the benefits of these smaller classrooms and these teachers that are all collaborating, all trained, all pretty much on the same page.
Yeah.
And I see the advancement in the children, so it's kind of like for a different time, I'm sitting on an opposite side, which is against what I believe, but yet I see the benefit of the collaborative piece. So, because every teacher knows every term.
Exactly. And they all, and with that size, so size does matter, right? Because with that size, and but I think the other thing that matters from what you're saying, it's a philosophical approach, a promised philosophical approach to the parents. That's
the idea is it's kindergarten through 8th grade, and the idea is once they graduate, they don't serve IEP children, so it's mostly children with an abstract or higher. So these children are then prepared for mainstream or inclusive education in high school. So that's kind of where the parents hang on to it that, okay, my child's behind a year in reading, so that gap is going to close, and we're going to move them on. And I've been in that setting, this is my 3rd year. I am watching children graduate and go on to high school.
and doing well. Yeah. So I think we've got kind of the gamut here between home-based and centers that are a network we're calling it, and then this inclusionary school where people probably wouldn't survive as educators if they don't know how to collaborate, or if they don't take the lessons that are given to them about how to collaborate. They probably wouldn't be out. So when I developed this format, what my thinking is this, that a typical practice among school-based SLPs, for sure, is fact sheets and forms and drop it off and say, here's some tips and try this, and it's all coming from a great place. Try this. That is level 4. So you can't just say, try this, or let's modify it this way, unless people understand why and what difference is it going to make if I do. So it is truly my belief that you have to go through these processes in order to bring people on board. Now, some people are going to go fast if you have some time and you've got some plans around it, or if you've got open thinking about it. But it's okay to progress slowly through this model. because that builds relationships. And that's really the core of successful partnering and collaboration is a relationship. You can't tell somebody what to do, but you can, make them work with you to want to work with you because they see the benefit and they see the positive outcomes. So most of the time people are feeling overwhelmed just about this whole process anyway. So that's again why I've boiled it down to these, it's more like a, how do we sort on this simply, a simple-minded person. So I think we have to be prepared to influence people. We have to be ready and know that what we're doing is trying to influence people. We're trying to get them to think differently about how we want to work together. And influencing isn't always easy, but we do see that we can be influenced by things.
But I think we also have to be prepared to
And I'm going to add that to this slide. As soon as I saw it, I thought, doggone it, why didn't I put that on there? But thank you. Yeah, we have to be prepared to, exactly. So I think we're influenced in many ways. Advertising for sure influences us, and advertisers know it. Color, temperature, the visuals, all those kinds of things. What are we doing to try and bring that our influence, make people want something? And I think it comes down to that impact piece. It comes down to them realizing that if the communication disorder is impacting that child's success, and their goal is child success, well, working together can really help make that change. But we have to facilitate discussions and be able to get people on a team, making team decisions. So I'm giving you 5 tools. They're easy tools, essentially, to implement. And they're the tools that kind of help you go through the stage process, basically. So for one thing, I think we do have to understand team collaboration we have to take a look at the teams we're on. So I would like you to begin to think about a team you're on. And if you're in an administrative role, a team that you've been on or you've observed, or a team you would like to see happen. Just put it in your perspective. I have something I call teacher chat. It's really engaging in conversation with teachers about kids learning and the impact of communication on that learning. It's starting to lead toward aha moments is what I like to have. So when you said you had an aha moment, I had to smile to myself because I really like those aha moments when somebody goes, oh, I get it. And then class observation at any level. So they're doing it home. The home observation is really interesting, and I think I'll add that in the future too, is that home observation and the chaos, the demands, the lack of, or overbearing. Either way, lack of engagement or over-engagement, either way, what do you see when you're in that home that is a demand on that child? So I'm going to ask you to kind of interpret that. I'm going to ask if you have something to share with us on that. Recommended strategies, techniques, and something I call communicate to educate. So it's how do we keep people informed and engaged, and how do we do this knowledge sharing that we talked about, because we don't really have time to do it in a really workshop-y way, or so how are we going to get that to happen? So let's start with the appraisal. So what we want to do is, how do we appraise your team's success? So how would you currently, pick a team. What I want you to do is pick a team, any team that you are functioning on or observed, and right now, kind of make some notes for yourself as how would you define that team in terms of success. And I'm going to give you some elements to do it on in a minute. But just for now, just kind of jot down your just immediate knee-jerk, such and so team is successful because, or it's not successful because. Just kind of knee-jerk, and don't have to write it down, obviously. You can just think it. Okay? So that's our number one thing we're looking at is team collaboration. So I'd like you to reflect. The stars are things that you can do. So reflect on 2 of your most memorable collaborative experiences, okay? So we have memorable in many ways, most effective, and challenging. So most effective. Think about what was the outcome. Kid got dismissed. Kid's functional communication improved. Kid gained a lot of skills and improved classroom performance. What were the critical components that made that happen? And what are some lessons learned? Does anybody care to run through an effective one? Just answering those 4 questions briefly.
So I would say that it's maybe a little bit of a slant, but working with a team.
Can you talk a little louder? Yeah.
Sorry.
Yeah.
Working with a
Here,
clinical
tap
team.
into my microphone here.
Working with a clinical team around a child with cerebral palsy. And really, we knew we saw an effective team process when there was a number of professionals, all who had their own goals, which were way too much for the family to handle. And the team was working together collaboratively around the family's goal to look at how their goals fit into that and what they could reduce and how they could maybe address 2 professions' goals with one activity for the family. So that type of collaboration and seeing that willingness to modify and say, you know what, right now this isn't important. This
Exactly.
we can leave this one off the table for now. We're going to work here. We'll come back to that. So that in the end, to me, the successful outcome was a plan that the family could buy into and could support with their resources. So that's
And succeed at, yeah. And also, what a learning experience, because, first of all, you had to talk about everybody's goals to decide which ones do you leave off the table, which ones do you add, which ones can you put together, and the how can you put them together. So do we have a challenging example of a team? Got a challenging one, and what were the components? Anybody share that one? I'm going to come back here, Steve.
I think sometimes the most challenging ones are ones where you maybe have an idea of what you think the main goal should be, and then maybe the teacher, we'll just use that as an example, doesn't really see that as the main focus. So I think in that moment, for instance, if I felt like a child's literacy goals or let's just go with written language goals were very important, but the child is in 1st grade and the child is identified as having learning difficulties. So that 1st grade teacher maybe isn't focusing so much on written language or writing, she's focusing on the phonological precursors, all those things that go with your primary teachings, the rhyming and all of those things, phonological awareness. And then to convince her that, okay, we have to start writing, even though some of these other things aren't in sync, you're going to have to start the writing process now. You can't wait until all of those things have kicked in to include the writing. So I think sometimes the most challenging is to blend what you feel and then also try to bring them on board without insulting or without assuming that you're the teacher. Just kind of having that collaborative piece come together. And I think the best way that I've seen to turn the challenge into an effective is to give them how to do it. In other words, like I'm not telling them what to do, but say, oh, so perhaps when I come in and push into your classroom, I could write a prompt of the day, or I could, provide it. Own it yourself instead of giving them one more thing to do.
Exactly. Yeah.
I think it's a little so much because you have so many needs that you have to, if you want it back and change, sometimes you have to hold it and offer help to do it.
Totally. And that's the intervention sharing. And there's a readiness to that. So we've shared a few. I'm going to go past this so we can keep moving, but because we have been sharing some of our challenges and barriers. But I think that the idea, though, that came from both of these, effective and challenging, is the idea of really having the conversation and understanding enough, where the takeaway from yours could have been the teacher convinced you that writing can't happen now because it can't happen in her classroom, because it can't happen as part of that curriculum there, and here's the why. And that would have been different, that if you get the why, or if it still makes sense, you give the how, that's the exchange. And that's where, again, the relationship has to be pretty coordinated. So here's the challenges I hear about when I do my workshops. Lack of engagement. Teachers aren't engaged. Confusion about priorities. Wait a minute, you're the speech pathologist, I'm not. Overlapping roles. Why are we both working on the same thing? It doesn't seem like it's sufficient. Resistance to incorporating specific recommendations. It's like I have no time, I can't do it, not my skill, don't want to ruin it, it doesn't fit in. Limited pre-service training. So one of the things that irritates me the most is the world is supposed to collaborate according to all reimbursement, according to all regulations, but there's no joint training. And the most successful cultures are when there's joint training, just like you said. They learn together, they work together, they're involved together. They get on the same page because they actually ate lunch together. They see what questions you ask. They hear your frustration. They hear the same teaching message from the speaker. And I just even think, sometimes people will, say, can you come and do a workshop? And I say, can we get the teachers there? Well, they're doing a different topic. And that's frustrating. So we have to kind of move that dime a little bit. And then a lot of funding restrictions on who pays for what if you use this code versus that code. So the coding situation is really creating problems, not just in healthcare, but in schools too, because disability code, service code, amount of time code, all this. So I'm saying computers are driving service delivery, which doesn't make sense. But what do teachers say? Not my expertise, too many kids in my classroom, too much to do, my priority is teaching, literacy and learning objectives come first, what about all the other kids in my class? These are real things that teachers really feel and should feel, because that's their domain. Lack of time. Didn't I put that on there? Wow. It's always lack of time. There are lots of reasons, and we won't belabor these. We know why we need to collaborate. Universal design for learning. It's meant to be doing this. It's meant to be sorting on how do kids learn? What's going to motivate them? What tools should we use? What would make this child be able to learn it versus that child? We can prove outcomes. We can assess when there's collaboration better. We can link to the Common Core better when we're collaborating. So reflections, we've been talking about some of this, so I'm not going to leave this up, but just things to think about your role, your approach, what you've done to try and make this work. So we're going to try I'm going to introduce the appraisal tool. So I want you to think about 2 of your current collaboration partners. So you just write down their name, and then I want you to give them a rating. Above average. So it's like something that you would do with a team Mondays, whatever, your IP teams or whatever it is. Pick a team, pick 2 people, 2 partners, or you can pick 2 different teams. Above average, average, or below average. 1, 2, 3. Just in your head, you can do that. Okay? So how's it going? Ask yourself this question about that one person that's below average or the one person that's above average. So to realize that I'm sorry, I got off on the wrong place on this slide. When we evaluate how we're doing, it's hard to do. It's hard to evaluate It's hard to evaluate our collaboration because there's so many different dynamics that are operating. But in order to do it, you have to have honest input from the team members And I think it can be simplified, so that's what I've done, is try and simplify it. We want to learn about, from, with others. So I boiled it down to 6 areas that we want to think about in terms of your team's collaboration. One is team membership. Do you even have the right people on your team? So if you're thinking about a particular kid, is it the right people? Is there some element missing on that team? And I've got some questions you'll see on the appraisal form about that. Are the goals right? And I think when you said that you eliminated some goals, you added some goals, that's what I mean here. Is it the right goals for the team to approach? Because you know what? This poor kid can't have 15 goals. That's confusing. And you also can't get it done in half-hour sessions of any kind of treatment, whether it's OT, PT, speech. It just can't be accomplished. It takes 20 to 30 hours to learn a new skill. Now, if you've got SLP, OT, PT, speech, motor, and behavior skills you have to learn, times 3, that's 15, times 20 minutes, or hours, times 20 hours, that's no time. There's no time. And even just that knowledge and saying it out loud at a team meeting can be kind of like revealing. So, information and data, what is it all based on? Is it correct? Team process, how are we going to work together? I mean, even like saying what day and time or what process for working together. How are we going to communicate with one another? Because we know time's a factor, and so how are we going to communicate with one another? How are we going to share information? Well, now we have online clouds and all those kinds of things. There are ways of communicating with each other. And then are we getting results? So team meetings where you're really talking about results. Are we getting it? Is it happening? Is change happening? And does the teacher now know that this kid can talk better? You know, like he really can? So were you going to say something?
No, I was just saying that I sit on a professional leadership team. The same process, just changing student client goals to system goals.
Mm-hmm. That's it. It does. That's the thing. System goes, and so when you see the form, you're going to be able to see how you can use it. So this is the form, and you all have it. You all can get it. It's on. I uploaded it for you. So it's hard to see back here. If you want to come stand closer, you can. You know, if you want to see what's on there, just to kind of glance at a glance. And I'm not going to read every section, but the blue words are those things I told you: team membership, statement client or student client patient goals, information and data, team process, team communication, and getting results. So let's look at, if we look at goals, here's the question. Has the team established concrete, measurable goals for improving performance? And that is for the team's goals. So rather than that sandwich IEP planning method, have you established a team goal? Like, we're here to not just discuss this kid, but we're here to do something together. So getting that goal established. All team members are working toward common goals. So your brilliant thought about just like, what are we going to do here, guys? 3 goals, 2 goals. For what time period? And then all team members are devoted to doing what's necessary to accomplish that goal. This makes more sense, a lot of sense rather, for kids who have multiple disabilities, because working toward, and that's when interprofessional collaboration really works well. We are all working toward, but you have to declare the goal. And it can't be, I'm working on XYZ speech and language goal, I'm working on XYZ motor goal, I'm working on this, because that has the multiplier effect of nobody being able to do anything. That's why your school probably does kind of work from this.
Well, what's interesting is when
and teaching the strategies, but not everyone pays attention to that. So if you had a team goal where
Exactly.
it was to extinguish or replace the typical things that a child is doing, like he's constantly spinning or whatever he's doing, and to replace it, everyone was working on that at the same time. You could incorporate your own goals still, but you would be cognizant and aware of, okay, OT is working on this grip, this child's supposed to have a grip on this pencil, I see the pencil, I don't see the grip.
Exactly.
Or
Right.
this kid has to have glasses to read, and I just noticed in his third period, I picked him up.
No glasses. So you've had the aha, yeah. And that is the aha that you want your teachers to have, or you want your other teammates to have too. Because then you're still working from your perspective as this like communication, but you're working on it with the big overall what's going to make it. And then when you talk together, you can say, I cue him this way. When I get him to respond, I try and get his eye contact in this way, and then then it starts. So that's exactly right. That's exactly what I'm talking about. It's like, what common goals? Another aspect is, are we all looking at the same information and data, and how? And that speaks to your IEP issue there. Team process. These are some key questions that you can ask your team. You can discuss with the team. Are we allocating enough time for planning and meeting? No. Then the team has to have ground rules and expectations. We're a team. We got to all show up. If you can't show up, can you call in? If you can't call in, can somebody take some notes and make sure you see it? This is all good team process, like you were saying for your system. This is good team process. The way this form works is all team members fill it out on their own. I agree, I'm undecided, or I disagree, I'm undecided, I agree. Okay, so this is a team process thing. It literally takes 5 minutes to do. And then people are going to go, I can't ask my teammates to do that. Well, if you don't, then your team's not going to get on the same page. So think about that this is a process. And if only one member of your 5-member team fills it out, then you two can talk about what's really important is what should we do about it, And so I do have some examples because I have people all over the country filling this out and telling me how it's working. So my suggestion for it is to complete it twice during the school year if you can. More. Kathy Kofel out in, I think, wherever she is, Oklahoma or Arizona, or one of those places, she suggested more often than that, like every 6 weeks or something like that, or if you're in a university, at the end of every term. So, respond in the context of your team. So that's how you would fill it out. In your team, the IEP meetings, open houses, events, tip sheets, all those kinds of things. Make it be with regard to your team. And then each team member really is saying their level of satisfaction of whether, and it's a satisfaction survey. I agree it's working really well. I don't agree. When somebody doesn't agree with something, then talk about it. And so a school where you're trying to get things going process-wise and culture-wise, this is a good culture issue, culture setting thing.
Do you ever have families evaluating about these?
I would think it'd be wonderful to do that. Like my team, just change the words. My team is, whatever. Yeah, great. That would be good. I'll try and use that next time too. I love these ideas. So openly discuss findings. Don't be afraid to have an open conversation with teammates. You're going to stay on level 1 and 2, of the stage thing until people get it, until people understand. This is kind of a way. So there's a slide. There's 3 slides in your PowerPoint that just explains what each one of those sections are. So what is team membership? What is student goals? So I tried to explain everything in the PowerPoint so that we don't need to belabor it, but just to help you understand the thought process behind it. So I'm not going to stick too much to these here. Team collaboration. getting results. Okay. So we had a case study in early intervention. There's a team in Maryland. They filled it out. This is a summary from the team. So they had all the members fill it out, and this was their summary. So they agreed that all team members are working toward the same goal, and their school is set up. Their preschool is set up along these collaborative lines. The team has established concrete goals for improving student performance. They couldn't, this may be one person's, I think, couldn't decide. The team has established concrete measurable goals to evaluate the team's success. No, we have not. So then, you can see their answers. And they had a lot of agree because, again, they are functioning pretty well as a team. So this is their summary. Oops, wait a minute. Unfortunately, the summary was in my notes. But overall, what this team did was they looked and they said wherever there was disagreement, they talked about it and they came up with a solution. So they established written goals for the team for how they were going to collaborate. And then another thing that they did is they wrote ground rules and norms for their actions. And that's what they put into place right away after filling this out. So it was, and then they're going to check back with each other, did they do it or not? And this was last year, and I checked with them, and they are still functioning very well. And they're now paying more attention to issues like this in their discussions, like, oh, we should do this, why don't we think about that? So what it does is it brings the team process more to a surface discussion, where it's just like, okay, here we are, we got to hurry, we only have a half an hour. It's kind of, if you can devote some time talking about that. I have a former student. Okay, I can see I didn't get this uploaded correctly. I think it might be attached to one of the handouts, but anyhow, I have a former student, and I had her when she was, 20-something, and now she has 20-something children. So we're presenting later today on are kids satisfied with therapy and how to change based on what kids' feedback is. So we're presenting later today. But anyhow, she's been doing this with her team, and they have a very small, rural school district. Everybody's been teaching there for 15, 20 years, very cohesive. But there were still things that they thought would improve the process better. So it's all about, this came up earlier this morning, how can I get people they have to commit to the process. It's a commitment that we're going to work interprofessionally. And what they're committing to is learning about, and with each other. They're committing to communication with one another and starting to have trust. And they're committing to plan and implement and sustain continuity of care. Because that's what happens when everybody does their own thing. There is no continuity. The example you gave will bring about continuity. We all are working on extinguishing a behavior. We'll all do it from our own perspective, but we're all going to be able to talk about extinguishing a behavior. We could have that same thing. We're all going to focus on having the child respond to questions. That's how I can translate it to speech language. So I want him to respond to questions. If we're all working on response to questions, then the teacher has to think, what kind of questions do I have him to respond to? The parent, what kind of questions am I having him respond to? The OT, when I'm asking him to do what kind of response am I expecting? So we can guide that communication with some suggestions and recommendations, and when they say, I'm not getting responses yet, we give the techniques. So that's how this starts, like picking a goal. And I like communication goals and behavior goals because those are common to all the treatments of all the different.
Just might add into that commitment for the kids who have multiple needs, the commitment to not just plan and sustain continuity care, but an integrated care.
Integrated care plan, absolutely. Yeah, integrated, where you integrate into the learning activity.
And the goals are.
And the goals are integrate everything, right. Okay, so now let's give it a try. Thinking about one of your teams, reflecting on your impressions, complete the appraisal form, and discuss your results with people sitting near you, which y'all chose not to sit next to you, and then summarize. So again, in the interest of time, I'm not going to do this activity today. But you have the form, and it would be for you to take a team and just run down those questions to prove to you that it only takes 5 minutes, and to prove to you that and to get you to look at it, actually, and then to prove to you that all those topics are discussable and they're not going to turn anybody off. It's really realistic practice. It's group practice. So you have the form, and it's a separate attachment from the PowerPoint, plus it's also within the PowerPoint. And if you get it and you can't read it, or you can't download it, call me or send me something. Okay, now we do teacher chats. So what do we talk about when we talk with teachers? And this can be a hit and run, or it can be a sit and chat. It can be any way you want to establish it. But I think talking to teachers or parents is the best way to really figure out what are the demands and what should be my goals and what should be my intervention techniques and what can they try in their classroom. Conversations have to be meaningful. So, if you don't see somebody, you have to just still make every moment count when you do see them. It doesn't have to be a sit-down meeting. So you want to, ultimately, over time, you want to develop a profile of the student's communication skills within the classroom setting, the home setting, the play setting. What are those communication skills? You want to highlight strengths from the other person's perspective. This is all about getting the teacher or parent's perspective. You've tested, you've evaluated, you're trying to pull information in, and I think you can do it through teacher chats. Use specific questions to guide the conversation. Review and take a look at what you found out. Now we can make recommendations. So that's why tip sheets that are try this, this, and this, and this don't work for me, because it has to really be matched to what the communication is really happening in their environment. This is what it looks like. So it's got umpteen questions. My thought is this: do not hand it to them and ask them to fill it out. It's one more thing for them to do. Do not ask them all 15 questions. I think it's 15, 1, 2, 3, whatever. Do not ask them every single question in one sitting. Build relationships. Hey, do you have 5 minutes? I got a couple questions. I just want to try and understand so-and-so's communication a little bit better. What kind of storytelling do you do in your class? What do you see in his storytelling capability versus the other kids? Now, I know everybody's probably going, I already do that. This helps pull it in a way that helps the teachers start seeing the puzzle come together. Why are you asking? What am I saying? It's starting to lead toward that, well, let's try this. So some of the questions, just because I know you can't see it. Do you feel the student recognizes and uses appropriate vocabulary? What's their take on vocabulary? Because they know the vocabulary the third grader needs to learn better than you. We still really got to start making the curriculum come together. This is all curricularly based. Can the student locate details and facts and answer questions and draw conclusions? No. Well, could I see the materials that you're using? Now I get to see some classroom materials. And so I would love it if you could sit down and do all of them at once with them side by side, but that becomes a task. This should be a conversation. And so it's all structured to, just let's chat. And that's why I called it a chat. So, what are some of the characteristics of the student's written work? In terms of grammar and whatever. And and so forth. So now I'm starting to get a picture of a few things. What's the curriculum look like? What's the teacher's observation skills in terms of being able? But even by my asking the question, my favorite thing that it does is it lets the teacher know that communication happens in the classroom. Because people will tell me all the time that the therapy room's over there, this is the classroom, and then that people don't understand that language drives the curriculum. This helps get at language drives the curriculum. Understanding language and communicating is really needed and necessary to succeed on the curriculum, because they're all curriculum questions with communication underlying each question. So then now I've got this information, I've started to put together the aha moment. Here's a few talking points to kind of get to the heart of it. So these are some of the key kind of things I'm trying to understand. I'm trying to get that teacher to describe ASA's communication during learning activities. That's what she cares about, is learning activities. I care about her communication during those learning activities. We come together. How is she following directions? Directions all day long, through the classroom and through the home. How is she following them? You have to understand direction following. You have to have communication. You have to understand first, second, third. Tell me about her ability to tell stories, relate events, convey. Frustration, can't relate, starting to find out how she's stringing language together. Do you feel she recognizes vocabulary? Cannot advance at school unless you can understand vocabulary. Can she keep up with the pace? Is she overwhelmed? Closing down, having behavior problems? Because the communication pace in a classroom is extremely fast. And it switches, code switching, whatever that people want to call it, switches all day long. So if I could only do 5 of those questions on the chat, these would be the ones that I would do. Now the questions are reiterated for you again. So you have them on the form. If you can't read them on the form, there's 3 PowerPoints that have each one. Okay, just wanted to make sure you got everything. So then what comes from that is like, if I am going to give ideas and techniques, what would they be? When I was starting to put together some of these materials, and these are, some of them go years back to kind of, two meaningful things happened. One, I went to work and my mom babysitted for my kid, and she was doing great language training with him, and I was watching her. And I was teaching language courses at the university. So go figure, right? So I bet lots of people did that kind of stuff. But the other thing was, I was trying to put it into like a nutshell. What could I teach somebody else to do? So I was watching myself in therapy. So what was I doing in therapy? Modeling good speech during all interactions. Reducing the length and complexity, and believe it or not, the rate of providing instructions. Repeating instructions. Checking to see if the student was understanding. Providing prompts and assistance. Reinforcing good attempts. This is what helps other people do it. But they need to see what it looks like in action. So when people are saying they're going to demonstrate, they're going to be in the home, they're going to be in the classroom, what I think our job is not to sit beside the kid. It is to sit beside the teacher. It is to let that teacher see us modeling these techniques. How slow is slow? Pretty slow. What's chunking? Chunk, chunk, chunk. 1, 2, 3. So to try and have a teacher see what we do in therapy, they have to see it.
Presentation yesterday, and they were talking about slowing the rate of speed.
Good.
And it was person. So
The lady explained that when you tell someone to slow the rate of speed, whether it's a student or a teacher, you don't tell them,
Tony Bashar.
you don't tell them to talk slowly. Teach them to parse.
Right.
I want you to take out your pencil.
Exactly. Pause.
Now I want you to open your book. because the minute you say talk more slowly,
They slow down the words. Okay. Yeah. Okay.
Pause, but the lady yesterday, she had a term for it, person.
Okay, I wish somebody would be taking notes for me about what I need to do here. Could somebody write down the 4 things I have to do when I leave? I have to infuse parsing.
Was the word parse, P-A-R-S-E?
I can look it up. Yeah.
Parse.
I have another thought that has been
Yeah.
me about working with other professionals.
Okay.
So we talk about when we're teaching contents to kids that we need to understand disciplinary literacy. Well, when we're talking to other professionals, we need to think about it too. We need to adjust our style of interaction so it's compatible with them.
Exactly.
So when you're talking to a school psychologist, you can talk statistics all day long and they love it. But if you're talking to a social worker, it has to be all about how you feel.
Those are great insights. Yeah. Totally great insights. Yeah.
So, and when you're talking to a teacher, they aren't really that comfortable with the graphs and the data. They want to talk about the particular content and what we're doing there. So we have to stop imposing our vocabulary on them and start understanding how they communicate so that they can not just understand us but engage us.
Exactly.
When they're engaged, then instead of just multiplying what we do, we can create synergy. And when we have synergy, then we're covered.
Right. We have relationship building. These are great, great thoughts. I'm learning as much as hopefully I hope you're learning some things, but I'm getting some great ideas. So basically we also have to, this is helping them understand us. They really don't know why we take who we take. They really don't know what the impact on learning is. They really don't know consistent criteria for eligibility. And why'd you take this kid? Take that kid. And why take them all? My question. Matching students to evidence-based practices. They have to do it with reading. We have to do it for speech. It's the same thing. And managing our workload. They really don't understand any of that because we haven't had the time or the form or we haven't hit the way to do it. So these are some things, again, you have a slide for this, these are the things that they need to understand. And you can talk about it in IEP meetings when you're trying to say, let's plan. So I'm totally against the word push in, by the way. I do not say push in. I'm not going to push my way into your house, push my way to the party. Well, I might do that, but I'm not going to push my way. But I really would like to be invited in. I would like to have integrated services. I'd like to do inclusion. I like to call. So I call that location, timing, setting of therapy, amount and frequency, intensity. If I need to see them 4 times, it's more intense. So when we're talking in IEP meetings, let's help them understand what our recommendations are around these lines. Amount, frequency, intensity. How long do I think it's going to take? I really never thought it would last 5 years. I really thought, given the problem, it should be done in a year, but I need to be more intense in order to make that happen. We need to see each other more often. So I need to increase the dosage of people, and dosage can be somebody doing an action. I need more people to be doing the intervention technique more often. So I can multiply therapy into 5 hours of therapy if I can have the teacher doing some of the techniques that I'm doing when I'm doing them, integrate them. So I like them to understand this stuff. Joint classroom observations, it's really important because we have to see what the demands of the classroom are, and they have to understand what we're seeing with them. So what I've done, there's another observation form kind of thing, and this is what it looks at. You look and you observe a lot of people, I tell you, every time people say, I don't know what I'm supposed to do when I get in the classroom. These are the things I think you should do. It's like, figure out what the demand is. What's the load on that kid's communication in that classroom or in that home? What is the load? A busy, frantic house? Who's talking when? What am I supposed to listen to? Who am I supposed to pay attention to? What am I supposed to do? What action am I supposed to take? I mean, that's very complex communication. Kill these guys here. Excuse me. So focus on the manner and style of the teacher. Again, fast talking, slow listener. Don't go together. Visual distraction doesn't go together. So knowing the characteristics, match it up with what you see. See what you see in the classroom and build your modifications on that rather than typical modifications that we recommend over and over again. Note the observations in major categories and then discuss why is he experiencing a breakdown or why can't you understand what he says during that learning situation. This is what it looks like. So you've got things like, where is the teacher teaching from? Okay, so we have just got a kid who we said he really, really needs to be able to be in a position to pay close attention to the teacher. So the default recommendation is put him in the front of the room. And then we watch the teacher, and she roams throughout the room, mostly on the side. That recommendation made no difference. None. So it's trying to say, what do I see when the teachers and the students are at work together? What's the student's workspace like? I mean, these kids who are very, like messy and all that, that's causing chaos for trying to get the work done. Make that a common goal. What's the pace of instruction? Boom, boom, boom. Really trying to move fast. You've got kids who are like, they can't even switch from one activity to the next. What would you work on together? Transition. Transition from one subject to the next. Hello. Method for assessing learning might be all wrong, given his skills and capabilities. So you get the idea of this, that it's really not looking at the kid when you're in the classroom, it's looking at the learning situation and the teacher.
So much pressure with these non-informed goals, and they feel like they don't have time to get done.
Correct.
Even when they're trying to get done.
Right.
And then you're coming in and let's work together. I can't work by myself.
Yeah. Yeah. So, this is where knowing your teachers.
I have to let them know, you're doing vocabulary. I can help with that vocabulary. Like, it doesn't take something else. Right.
Well,
I've never seen teachers in such defensive
I know.
mode.
Yeah. Yeah.
I feel like we're coming at it at such a hard time for them because
So
they don't know what to do.
And my solution about my recommendation about everything I'm showing you is, I got a couple of recommendations. One is you can't do it all at once. So pick a thing. You can't, and observing in the classroom, if it's like they're under pressure, trying to do all, it's not going to work. So what do you see when you go in to get the kid? And so I think you have to modify this in any way, shape, or form that it works.
I was walking the first thing, I asked him, this is what I want to work on, what do you want?
Well, and I think it's a great place to begin.
What do you think is important so that I at least can help you out? And usually then they're like, oh.
Yeah, come on in. Well, I think it's also, being able to just take pieces of everything, just a little piece here or there, and, kind of what, just see what works. Yeah. So basically, conceptually, what I'm basically saying is we have to understand the demand load on the kid. There's more slides within there. This is what demands are in the classroom. It's what they look like. So when we look at a kid's communication profile, we're looking sometimes at production of speech, production of, sentences, expanding sentences. This is what they have to do every day. So these are the common goals that when you want to come to a commonality among a team, these are the things that happen in a classroom. that the demand load is. I can't take the question because we're not like one. Yeah, sorry. I just want people to see what's here. So these are some of the things that you really want to try and figure out if you're going to work together. It's on things like when can we work together, how much, and so forth. So I'm really going to speed along just to let you know that all this stuff is in the PowerPoint. It gets down to what can teachers do in the way of instructional intervention. These are techniques that will help and work in the classroom. Teach one, not every page you see. Pick one. Do you want them? You think it's going to help to reduce the length of giving directions? Then help them learn how to reduce the length by parsing. So that's how you pull that together. Okay? These kinds of things. If you can't understand that kid, the biggest thing to help that teacher do is figure out the code. That will help that kid. If it's a kid who's really hard to understand, help the teacher figure out what to listen for. The rhyme, we figure it out right away generally. Break that code for the parent and teacher. Okay, communicating to educate is really doing what we're talking about, just really, really getting engaged in communicating. And there's a lot of ways to do it. Newsletters, and pick something up here at the convention and give it to your teachers and tell them, not, hey, just spent a great week in Philly, here's what I picked up while you were working. But bring them back something and just share it with them. It's like, thought you'd like this. Administrators, if your administrator paid 1 penny for you to come, send them a note. Thank you very much for supporting my meals while I was in Philadelphia. It was a great meeting. The one takeaway from it is I got some ideas on how to collaborate better with teachers. I'd love to talk to you about it. Let them know. Same thing, get engaged. Have a plan around doing it if you really want to formalize it for your professional development plans that you have to make. These are good ideas for you. All of these tools can be used on your professional development plans that you have to make in some school districts. And do an action plan. Do something little on one of these things. So the action plan is to pick one of the dynamic tools that we've talked about and just try it out. Just give it a try. And try it with your team. Lots of resources. ASHA has tons of resources. Look for them, look at them, and then I gave you a bunch of references. Okay? So that's it. Whew. Thank you. Thanks for being so interactive because it made it much more fun for me too. So, okay? Thanks very much. Good luck. Have fun.
Thank you.
Go watch the race.